Hello, my name is Sydney Mershimer. Today we will be discussing a Villa Health scenario regarding cystic fibrosis and proposing an evidence-based plan to improve the safety and outcomes for the patient. First, let's discuss the patient. Caitlin, a 2-year-old, was readmitted to the hospital for pneumonia within 6 months. Through interdisciplinary collaboration, the team was able to finally diagnose with Caitlin with cystic fibrosis. The team then identified barriers to care for Caitlin and her family, including living in a remote area with very limited healthcare access, social disturbances between Caitlin's parents, possible financial problems, and the need for a caregiver while both parents work full-time. Caregiver role strain is also a barrier because the day-to-day care that will need to be given to Caitlin to avoid any of the cystic fibrosis respiratory illnesses is a lot. Once the barriers were identified, the interdisciplinary team was able to address the barriers step by step. The interdisciplinary team for Caitlin's case included the pediatrician, the bedside nurse, the respiratory therapist, the social worker, and her home pediatrician. Identifying these barriers early on in the process will allow the team to address each barrier to Caitlin's discharge. I will now discuss an evidence-based care plan to improve safety outcomes. Implementing evidence-based care is a great way to ensure quality patient care. The care plan will be designed to address Caitlin's specific needs. The goals need to be attainable and be able to track her progress. Caitlin's goals are to maintain optimal respiratory function, oxygenation, and manage secretions, prevent infections and hospitalizations, ensure adequate nutrition and adequate fluid intake, and maintain adequate weight and growth pattern. With a new diagnosis of cystic fibrosis, it can be overwhelming, but it can be broken down into segments. First, assessment. Assessing for signs of respiratory distress, infections, weight loss, and bowel obstructions. Respiratory distress is monitored by respiratory rate, the depth, increased heart rate, oxygenation, and skin color. Infection is shown by increased temperature, cough, sputum production, respirations, and heart rate. Monitoring daily weight is important, and keeping a day-to-day log is also important so that the parents can tell when the weight starts to fluctuate. Assessing for bowel obstructions entails monitoring the number of stools, color, consistency, and how often they are occurring. Then, specializing in treatments. Chest physiotherapy to loosen secretions in the lungs and encourage airway clearance. According to Gupta, from 2020, chest percussions is an adequate way to remove secretions from the lower airways in patients that are unable to clear them themselves. Further data was needed because it was needed to help the parents understand that although chest physiotherapy is not going to be comfortable for Caitlin, it is essential. Administering fat-soluble vitamins, ADEK, to promote absorption of nutrition. A diet high protein, high fat is essential for cystic fibrosis patients to ensure weight gain and growth. According to Elborn in 2016, a high protein and high fat diet is essential for cystic fibrosis. Educating the parents, because without it, the patients will lose weight very quickly due to their inability to absorb most nutrients. Giving pancreatic enzymes before each meal and snack increases the nutrient absorption. Finally, the parents will be administering Dornase Alpha, an aerosol that is inhaled through a nebulizer, and possibly additional antibiotics to help fight infections. Educating the family on how to manage all of these tasks is so important. Evidence-based practice states the education should begin on admission. Printing of written materials can also be helpful so that they can look at them at home should they forget what the nurse said in the hospital. Also, finding the family a grief counseling group or a cystic fibrosis group is important so they do not feel they are alone. According to Kademi in 2017, parents of a child with a chronic disease need to also be considered for coping strategies regarding stress and anxiety to a new diagnosis. But the family needs educated on the signs and symptoms of respiratory distress, infection, how to prevent weight loss, what each medication does and why and when it is important to take them, how to monitor for a bowel obstruction, how to specifically do chest therapy, and what kind of diet they should be feeding Caitlin. The family also needs to be educated on what is normal in regards to bowel movements, respiratory status, weight gain, and loss. Knowing the normals will help identify the abnormals. Keeping a log each day on all of these things can help the parents and physicians evaluate positive patient outcomes, as well as keep track if the patient starts to decline. For future care, once Caitlin is released, they are going to first go to the nearby pediatrician if the parents see a change in Caitlin's status. From there, the nearby pediatrician will assess the patient, and if the pediatrician feels it is out of their knowledge scope, they may call the hospital and use the hospital's interdisciplinary team to help decide if they should seek more in-depth help or if this is something that can be fixed in the office. So they could reach out to the social worker for any social dilemma, the nurse for any questions that she may be able to provide, or the actual pediatrician at the hospital who cared for Caitlin during her hospital stay. By having access to the hospital and their resources from their own pediatrician's office helps save the family a trip and also keeps up to date in future care situations. The doctor from the hospital will already have a heads up on what is happening. Keeping an open line of communication from the office to the hospital is very important. Monitoring Caitlin's status is the most important thing for the parents to be able to do. It is our job as healthcare providers to educate them and give them the tools that they need to succeed with their daughter.